suffer from lower back pain? Poor lifestyle choices like smoking, lack of regular exercise, bad food habits, incorrect posture, and many others may be to blame. The pain you feel in your back is most oftentimes caused by having what's known as a slip disc. A slip disc is basically a bulge on one of the discs that are between the tiny vertebrae in your back. Poor lifestyle choices and back trauma are the primary reasons for this condition. When the disc bulges out far enough to press on the nerve, it causes pain, sometimes more severe than others. Pain radiating to the hips, back of the knee, heel, and toes are all pretty common. If you're suffering from lower back pain, the bottom line is that you just cannot neglect it any longer. Good chiropractic care will help you finally find the relief you need and live the pain-free life you deserve. We have years of experience and thousands of satisfied patients. We would love to reduce your pain and have you be our next happy patient. Contact us today.
All right, so this is your second visit today, right?
Correct.
Can you tell me what was the reason why you came here?
I have a pinched nerves in my neck. There are 3 pinched nerves, and I had a steroid injection from orthopaedic on the December 30th to help alleviate.
December 30th of last year,
December 30th of last
right?
year.
So 2 weeks ago.
2 weeks ago, and the steroid shot took for a few days, and then it went right back to my shoulder, my nerve in my arm, my elbow, and into my fingers that had been happening for the last 6 months returned.
So basically it was worthless, right? It didn't
it didn't work. And then for something I did over the weekend of last weekend, triggered a horrible episode where the nerve really got inflamed in one of the vertebrae. I'm not sure which one. Monday, I basically slept in the fetal position with my neck all the way to my knees, was the only comfortable position to alleviate the nerve from hurt. I got adjusted over Wednesday. I don't feel any of the issues that I have with my nerve. My tingling in my fingers are just barely noticeable, comparatively speaking.
That's just after one session.
After one session, and my neck is a little bit stiff, but I understand the process. It's going to be a little bit stiff and a little bit slower. I get it because it hasn't been messed with for such a long time, and it's probably been set in a wrong position. And I take it in a grain of salt with how chiropractors can do it. But at some point in time, it's just surgery or a chiropractor, and I've dealt with chiropractors before that put me back in position, and I don't seem to come back. But you know what? As a course of action, they seem to do pretty well.
And your other orthopedist, he suggested surgery, right?
Yes, he suggested surgery.
And that was with fusion. C4, C5, C6 fusion.
Yes, fusion, and he had. He gave me no other options. He didn't say go back to therapy, try heat, try something different. He walked out with no conclusion. So that's why I found at your services on Google by chance. Google San Leandro, somewhere close to work. Had a conversation. Told you my expectations, what I could see. Just by getting treated, what we come with agreement. You're telling me that I'm not going to make you go for 6 months because I don't believe chiropractors should take 6 months to get you going.
I agree with you.
5 to 6, 10 visits, something where we can agree upon that I feel comfortable, that I can help my body and take care of myself, and that's kind of what I'm looking for.
So what's the percentage of improvement you would say after that first session? Today is our second session.
Probably 75%.
That's pretty
It
good.
feels better. Yeah,
Comparing
I feel
to
better.
fusion surgery and injection.
Well, I couldn't lift my neck up in the air
Mm.
on Monday. I just couldn't. I had to have my head down like
Yeah.
this. So
And now it's
now I feel that, and like I say, by being sore, it's finally like probably supposed to be like it's supposed to be. So I can imagine the muscles around my spine are sore.
okay. Well, that's good. I'm glad we have achieved something that you've been searching for a long time.
Right.
Alright, so let's do the same thing we did last time. Just this, again, it might sting, but
Yep.
you know, that's normal. Okay, just
Okay.
relax, don't fight me back. Okay.
Yeah, that always takes a
That,
second.
touch that nerve, but it's not as intense as the first
No,
time.
oh no, nothing.
First time I remember you jumped.
Yeah, it was no. That's all right. That felt like a normal.
Yeah. Stand up for a second, please. Okay, go ahead and lie on your stomach face down, please. Take a deep breath in. Breath in. No, breath in.
Okay.
Out. Okay, breath in. Out. Go on your side, please. Face me. I got it. Just relax yourself. Okay, good. Okay, sit up. That's good. He bounced it pretty good. Okay, go on this side of the wrong spine. Relax. Okay, good. All right. So let's go see Gail.
Okay.
Let's get those 25%, so you're back to 100%.
Yeah.
Okay.
Yeah. Okay. Good.
All right.